I know we have people joining from everywhere, so just a quick reminder on the topic for today's webinar itself. Our key topic today is to discuss how we can improve SNAP access for older adults. We all know at least 10 million older adults, about 50, were food insecure and have struggled in accessing healthy food and nutrition. And SNAP has played an important role in addressing food security for older adults, and yet a large percentage of the older adults who are eligible are not participating in it. So for today's call, our goal is to discuss as a group here. We have panelists coming in here from community organizations, state offices for aging, and also senior center representatives at the national level, and an AARP Foundation who does a lot of research and innovation in this space as well. So our key objective for today is to discuss some of the current challenges in improving SNAP access for older adults and potential solutions that we can especially leverage from our learnings during the pandemic, what we can implement today and moving forward. And we also hope to have some predictions around the policy changes that could be upcoming. I know it's a very tricky time, like we just had the public health emergency end on October 31st, and we also have an election coming up. So there's a lot that's going to be changing in the next year or so. So we thought it's a very timely discussion to bring everybody together. So I'm Kavita Gnanasambandan. I'm a co-founder of Blooming Health and also the Chief Commercial Officer. We are especially convening this discussion today because of some of the work we've done with AARP Foundation in the past year around improving SNAP access. And so I want to give you a little bit background on who we are and also introduce the panelists before we get started with the discussion. So at Blooming Health, our mission is to power healthy aging in place. And we are doing this by connecting older adults and caregivers, especially family caregivers, with their community-based organizations and area agencies for aging and all kinds of aging care providers who are looking to bring services to them that can help them to age in a healthy and independent way in their own homes and communities. And of course, as a key part of aging in place is food security and addressing access to healthy food for older adults. So from our platform, we have a remote engagement solution that's helping connect aging care providers and their staff with older adults and family caregivers via an inclusive communication solution. So on the staff end, they have access to a web-based portal that they can use as a centralized communication platform to reach older adults via text, phone calls, emails, and in multiple languages. So the older adults can receive the messages from the aging staff, even if they don't have access to internet or a smartphone. And we also want to reach people who don't speak English as a first language. This is why we enable auto translation to 25 plus languages. And this solution is being used by aging care staff in their workflows in multiple ways. And this includes sending announcements and information, especially around SNAP, what changes are happening, and also to educate people around SNAP on how they can be eligible and how they can undergo screening to identify eligibility criteria. In addition, aging care providers are using this for multiple other things that they're doing, including housing, transportation, and any other services that are needed for healthy aging in place for older adults. We are grateful to have partnered with at least 15 different organizations across the state of New York, and we also have partnerships with in California and Arizona. And we work with a wide spectrum of aging service providers, from state units on aging, area agencies for aging, Native American tribes, to community-based organizations who are all providing direct services to older adults to enable them to aging in place. And then we also have partnerships with enterprise organizations and research foundations like AARP, especially as I mentioned, in the past 6 months or so in 2022, we were able to do a project where we were collaborating with community organizations that are supporting older adults and AARP to bring timely information about SNAP benefits to older adults and help them engage with SNAP applications and enrollment itself. So we are going to be sharing some of that data today as we go into the discussion as well. So this is Blooming Health. So I want to pause here and also introduce our panelists that have joined us here. So we have 4 great panelists, as I mentioned. We have Paulo Narciso, who's a vice president at AARP Foundation. We We have Rose Golden joining us as Deputy Director at New York State Office for Aging. We have Bob Blancato, who is an Executive Director at the National Association of Nutrition and Aging Service Programs. We have Jim Wengler, who is the Director of Programs at Hunger Free America. Again, we very much appreciate the time that our panelists have taken today to join this conversation. So I want to give it to them to introduce themselves and say a few words about their experience in SNAP and the perspectives that they wish to contribute to the discussion today. Can we please start with you, Rose?
Sure. I am from the New York State Office for Aging. And while I could go on and on, to contribute today, we want to talk about our work in the nutrition world and in the SNAP world. We do administer the largest nutrition program in the nation. Last year, that includes home delivered and congregate meals, nutrition education and nutrition counseling. Last year, we served 18 million, just about 18 million meals to 170,000 individuals. So we have a very robust program. And our programs are put out through local offices for aging, which I will bring kind of the perspective of what they are doing. They are the core of our network. But then through subcontracts, we have about 1,200 service providers in New York State. Our offices for aging serve about 29,000. They fill out about 29,000 SNAP apps, help with applications a year. We distribute just about $2 million in senior farmer market coupons a year. We work with Ag and Markets on that program. And they also assist in connecting older adults with SNAP through that program. We're also using a lot of engagement strategies for older adults to help them with eligibility, which I will talk about later, I think, under innovations. And we have a SNAP education program that we've partnered with OTDA because there was a need to reach older adults specifically, and they came to us to do that. So I will share about that later. So that's really the perspective, what we do through nutrition and how we help with SNAP outreach.
Great, thank you so much, Rose. Paulo, please.
Thank you.
Hello, everyone. Thanks for having me on the panel. I also see some attendees from my state of South Carolina, so a welcome to all of those from the Palmetto State joining this particular webinar. Although I'm based in DC most of the time. So my perspective obviously is coming from ARP Foundation. As you know, we are the affiliated charity of AARP, and our focus is on quite simply putting more money in the pockets of low-income older adults. So they can afford and achieve the essentials that they want to be able to age with dignity and with purpose, which is the mission of AARP in general. I'll also bring a perspective from innovation. We have worked with Cavita and the team at Blooming Health in this in a pilot, and happy to share the results and our perspective on the pilot and why we took that particular approach, and looking to see how we can get more money in the pockets of low-income older adults.
Bob, please.
Hi, Tabitha and Nima, thank you to be here. I'm delighted to be on with Rose and Jim and Paolo to be on this panel. I come at this from the perspective of being a national advocate on behalf of older adults, particularly in the nutrition space. As Rose knows, we work a lot with them on the Older Americans Act nutrition programs and adequate funding. But SNAP is critical to older adults, and we are making, because of the great work of the ARP Foundation and others, we're making progress on getting more older adults enrolled. We need to do a lot more. I mean, but we've come a ways. And I think as we go deeper into the, hopefully the post-pandemic period, as we approach the Farm Bill's reauthorization next year, that ought to be a priority to get those numbers up above, well above 50%, up to 60% if we can of enrollment. But people now understand the value of SNAP, the growth of SNAP that's occurred because of the pandemic demonstrates its value, its importance. But it still remains a national challenge that people who are eligible for programs need to be able to get to those programs, and whoever can facilitate that should be supported. And that's why I'm very happy to be part of this conversation today.
Thank you, Bob. Please, Jim.
Yes, thanks, Kavitha. Hi, everybody. Good afternoon or good morning, depending on where you are. I'm Jim Wangler. I currently serve as the Director of Programs at Hunger Free America. We are a national organization, formerly the New York City Coalition Against Hunger, but we expanded and changed our name 6 or 7 years ago. We do a lot of policy and advocacy, also a lot of direct service. Which is where I kind of fit in here. I've been with the organization for 19 years, quite a long time. I'm currently out in Bend, Oregon for the last 4 years. So I left New York City and in a very different place, but still have lots of ties back to New York. For most of my years with Hunger Free, I was the director of our Benefits Access Department, which is our largest direct service department. Big part of that is connecting eligible households with benefits like SNAP. Increasingly, we also do a lot of work around WIC. So for most of those years, I managed programs and teams that did on the ground outreach, again, mainly in New York City at a variety of community-based organizations. This past year, actually, I'm happy to say, is the first year that we received a grant to focus specifically on older adults through the AARP Foundation. And we are looking forward to continuing that work over the next couple of years. So I'm not a policy wonk. I don't have all the facts and figures at my disposal, but I do have a lot of years of conducting outreach amongst eligible populations. So happy to be here.
Awesome. Thank you so much, everybody. We are glad to bring this diverse panel here. As you said, Jim, like we want people, both the policy wonks and the people who do the work and do the outreach. So it's going to bring that diverse perspectives for the discussion here. So before we dive into the discussion, just a brief reminder to everybody, please feel free to add your questions in the Q&A section and use the chat for discussion purposes. And also thank you, Kayla from New York Hunger Solutions, for reminding us that actually the public health emergency has been extended until January of 2023, which is great news. So let's kickstart the discussion here. So I think the key topic that I want to use to set the stage here is around the access challenges itself that older adults face today. We know, as I mentioned, there are a lot of eligible older adults who are looking to put food on the table, struggling to make ends meet. And we also know about the benefits of the SNAP program in improving economic opportunities and improving health outcomes for older adults. So given this gap in participation, what are some reasons that older adults are not being enrolled in SNAP? So I want to use some data as well to support the fact that there is low participation in SNAP today, right? Based on at least the broad-based categorical eligibility at each state, we know that only 29% of older adults who are eligible are enrolled in SNAP. And then on the higher end, when we use the other types of methodology around federal eligibility criteria, it's around 48%. Nevertheless, it's less than 50% overall of 60 plus years of older adults who are participating in SNAP today nationally. And this is just based on 2018 data. And we know currently we face inflation, which is leading to more people being more vulnerable and having issues and food challenges. And then the data also shows, as you can see, the differences in states, the SNAP participation rates across the states itself in the US. So this is where I would love to hear from the panelists here on what are those challenges that are making it difficult for older adults to access SNAP. So I want to start with Paolo. I know since AARP does a lot of research in this space, anything that you can share to kick us off? Sure.
Back in 2018, as you know, Capita, we did quite a bit of research working with Mathematica to figure out exactly why older adults are not participating in SNAP in the numbers that we need. Bob talked about it real clearly. We need to increase the number, whatever it is, whether it's in 29 or 48%. We know there's about 16 million or so older Americans who can participate in SNAP, aren't participating in SNAP. And the issues we've known for a while, we've known about the burden, how burdensome it is. It's a complicated process. in some states, not all states, some states have certainly improved, to be able to apply for SNAP. We hear the approach that we've taken is very much from an experience management perspective. Whenever you try to get users to use any kind of application, you want to understand what the barriers are and why they're not using it. Certainly, the burdensome piece is one part. The other part is the fact that some seniors just don't feel it's worth it, right? For the amount of benefit that they receive may not be worth the effort for them to actually complete that burdensome process. There's a huge issue around stigma, how SNAP is marketed to particular communities. And I can potentially give some perspective as we started working from an equity standpoint at the foundation, the ARP Foundation, of looking how we distribute access much more equally across the population percentages in the United States. And so there's stigma involved in that, cultural stigma across different communities. And lastly, it's the access to technology and the lack of education around SNAP. So those are just big challenges that have been around for a while. And we want to dig a little bit deeper into what those experiences are and figure out how to craft an experience and help our grantees craft an experience that overcomes these particular barriers, putting the older adult at the center of everything that we do from an experience perspective and treating them with dignity and care. The last thing that we also learn is that many of the people who don't participate in SNAP who are eligible are actually living with family members, right? And so that's actually one of the reasons why we embarked on a pilot with Blooming Health, is because of the fact that the outreach sometimes should go to the caregivers to help the people in their care to be able to receive the benefits that they are entitled to and richly deserve.
Yeah, no, I think that makes a lot of sense. I think we've learned similarly from our own experiences is people who are generally less aware are people who are living with others, but also in terms of relatively higher economic, or 200% and above FPL might think I'm not eligible, or I might just get a very meager amount. So that makes a lot of sense. So I want to ask Jim, from your perspective, since you are talking directly to older adults around outreach, and what have some of the reasons that you've seen as common, and how does it correlate with what Paulo was sharing as well?
Sure. Yeah, I guess just two things I'll mention. One is, especially during COVID, we saw it was difficult because a lot of the seniors we worked with over the years really want that in-person service. All the online options have been around for a while, and obviously, there are older adults who are happy and comfortable, using that platform. But just one site to mention in particular, in Chinatown in New York City, the Chinese Consolidated Benevolent Association, they're the oldest service organization serving the Chinese community in the country. We've been going there for probably 10 or 12 years, varied over the years, but sometimes 1 or 2 days a week, and helping incredible amount of, obviously, with staff that speak Mandarin and Cantonese, and doing that in-person work. When COVID came and we shifted to doing our work 100% remotely, we lost contact with a lot of that sector of the population. So I mean, that's one thing to mention, and thankfully we've been back there more recently. Hopefully it'll stay that way. Another thing just to mention is I think there is this perception amongst a lot of older folks that SNAP is something that is not a program for them, for various reasons, seeing it as welfare, seeing it as something for those who are truly destitute, living out on the streets, or would not survive without it, where and I'm sure many of you who are taking part today have heard similar responses. So our kind of tack on it, or something I've always encouraged our staff to focus on, is that SNAP is a benefit that they have earned over their lifetimes through paying their tax dollars, right? And I like to compare it to unemployment benefits, Social Security benefits. there are not, to my knowledge, huge outreach programs or webinars like this talking about why aren't people accessing unemployment benefits or Social Security benefits. You know, those are not the easiest applications, maybe. I mean, there's differences, obviously, but just to put in that perspective of, you know, if you're taking advantage of your Social Security, which I don't have the facts in front of me, but I think the percentage is certainly much higher than SNAP access, you know, or for those who are working, unemployment benefits, this is another benefit that's available for you to use for the time you need it. You've paid your tax dollars into the system over your years. So, you know, it's there for you when you need it.
Yeah, no, I think that messaging is powerful, and I appreciate that on the ground interaction in their own communities can make a difference. So I want to ask Rose, like in terms of the New York State itself, yes, there is relatively better participations than other states, but what are some reasons it is better, but what are some challenges that you're still looking to address to improve participation?
Yeah, thank you. I think what we're hearing from the other panelists too, you know, is pretty common, and we're hearing some of that too. I did reach out to some of our providers and our AAAs. Same things, you know, stigmas and misconceptions. Some of the people too, it's, you know, the misconception that if I take this benefit, someone else is not going to get it. So not only that they don't, that they shouldn't have it, but that I don't want somebody else to not get that. So that's something that was something that I thought was good to think about when you're giving a message to an older adult, when you're working with them directly and reassuring him of that. Came up a lot, and I'm seeing it in the chat, the challenge of compiling supporting information to make sure they get everything in and get their applications. And that a lot of older adults, yes, for the amount of money that they might get, say it's not worth it. It's too much work. I can't stay on top of it. So we're seeing that a lot. There was discussion that some ongoing delays in the U.S. mail postal system were causing some trouble with some deadlines, was my understanding. And then I think that's the main thing. They're just really worried. And also, you know, we as an aging network have done really good work at telling people not to give their information out and not to, you know, respond to things online and not to do that, because you've got to be careful of, you know, fraud or things like that. So just to support what Jim's saying too, that in person, that being with a trusted individual is critical, and the partnership so that you can get to the ground. I think that I really, you know, I think we're all hearing the same thing, but yeah, that simplification is important.
No, I agree with that. I think to your point, in terms of the right messaging and getting it to them through the right channels that they trust, I think is really critical. And that's been our learning, not just in the nutrition space, but across the aging support services space. And on that note, I want to ask Bob, like Bob, you work with both people on the ground who are doing the work, and you advocate on behalf of older adults with the policymakers. So what have you seen as some larger trends in the challenges that have been faced by older adults in the last few years, even during the pandemic and before that as well, in the SNAP access area?
Well, I think there's a greater recognition of the importance of SNAP, but there's at the same time, there's an increased recognition of the fact that not enough people are getting to the program. And all the reasons that my colleagues talked about are accurate. I think the one I would throw in addition, if it hasn't already been mentioned, is transportation barriers. Critically important issue. That's one of the most overlooked service issues that we have in this country affecting older adults. How do they get from place to place? How do they get to programs that they want to be part of? How do they get to their doctors? How do they get to, you know, the transportation programs are very important. I think that the emphasis now is, you know, I think Jim mentioned it right. I mean, you know, the program was changed, the name was changed to SNAP to get rid of the term food stamps as the main point of it, but it's still there. It's still referred to, you know, it's the old food stamp program. Once you put the word food stamp in, the stigma issue comes right to the forefront, and versus supplemental nutrition assistance, which is really what this is intended to be. So I think what you're going to see, and I think, as you mentioned, we've talked about, there's a recently completed White House conference on nutrition health and hunger. I think because of what appears to be a pretty strong commitment on the part of the Department of Agriculture to address the benefit issue, the maximum benefit and the minimum benefit issue in SNAP, I think is going to be hugely important going forward to addressing that concern about it's not worth it. Okay, because if you can, and the other part that's very important, and Rose knows this particularly well, it's the ability to collaborate on the benefit programs that are available to older adults. Okay, they get the meal, they get the home delivered meal, they may get some supplemental food from the food bank. They should get additional benefits through SNAP. Yeah. And this is where the aging network is really important. It's putting the pieces together so the older person understands what's available to them and why it's important for them to participate. And the last thing I'd say on that front is one population that's particularly important right now for us to focus on, I know the foundation does, I know all my colleagues do, are the increasing number of grandparents raising grandchildren.
Yeah.
Okay. They must be given all the help they can possibly get. And this includes facilitating applications for SNAP and other programs because they are confronted with a situation that a lot of them didn't expect. They do it readily. They do it wonderfully, but they should be able to get the assistance that they need to do their job right.
And
yeah.
Kavitha, if I could just real quick add on to what Bob said about grandparents caring for grandchildren. You know, we, as I mentioned, we have a component, a few folks that focus on specifically on WIC. And that, you know, talk about not being aware about SNAP, many grandparents who could be getting WIC benefits for the grandchildren, you know, have no idea about that. So that's just something to add on to letting that particular population know about what benefits are out there.
Awesome. No, these are all very valuable information. Go ahead, Rose. Did you want to jump in?
No, I was just going to say, yeah, we have a very strong caregivers program, which also works with grandparents raising grandchildren. And as we do assessments, we're working to put information in those assessments that let us know that someone was eligible for SNAP and to be able to do that. So, yeah.
I also want to just make a point because I'm sure you all are doing the same thing. You've got fabulous chats going on here. You got fabulous data, input, suggestions, ideas. I hope you capture it and you know, you put this together into some composite because there's some great stuff going on here.
Yeah, no, the chat is definitely can be saved to your local drive just as a reminder, and we're going to compile the chat and share it after the webinar as well. No, I agree with you. I think people's experiences on the ground are valuable. On that note, I wanted to actually do a poll from the audience regarding the challenges you're facing. So let me just pop this poll quickly up on the screen and please answer it when it shows up on your screen. I'm going to give it these 30 seconds or so everybody can read it and then answer it. Without a doubt, I think the complex application process is winning. So the question is, what are some challenges you face during SNAP outreach and enrollment for older adults today? And low older adult awareness and engagement being one of them, less meaningful SNAP amounts, complex application process, low staff awareness about the latest SNAP policies and program changes.
Gary, I just wanted to add that even in the comments and questions, application complexity is one of the repeated pattern. I mean, not probably new to a lot of panelists, but just wanted to mention.
Yeah, no, I think that's a great insight and an important point to capture. So thank you so much for answering the poll, everybody. I think most people have had a chance. So I'm going to let that keep going while we use that as a jumping point to actually get to talk about potential solutions and tips that we can share with each other here on what are some things we can start doing already in terms of improving that SNAP access for older adults. Definitely, we need to talk about some policy changes that are coming in terms of improving application processes or enrollment processes, and what Bob talked about is invaluable in linking SNAP application to other benefits and other needs that people may have. But to kick started, I want to focus on any learnings that the panelists have had from the pandemic itself. Like during the pandemic, of course, there was a lot of adaptations and flexibilities in how SNAP was being applied for and including the maximum amounts that people were receiving. It obviously had a lot of learnings for us. So I want to start it there. And I want to start with Jim to see how are the flexibilities during the pandemic helpful, and which ones do you think would be most helpful for us going forward?
Right. So thanks, Kavitha. So just two things I'll mention again. One is we underwent the process starting back a couple of years ago to obtain the permission from in New York City, the Human Resources Administration that administers SNAP, but then also with OTDA, the Office of Temporary Disability Assistance on the state level. And it took a while, but eventually we were granted the ability to acquire telephonic signatures from clients over the phone, right? I know this is something that has been, I believe, and if anyone else on the panel knows more about this, during COVID, I believe county, at least in New York State or in other states have been granted the option to waive the need for a electronic signature. So I'm not sure exactly where that stands, but we were one of the first, and maybe just one of now only a couple that have sort of an ongoing, it's not just a temporary COVID waiver or situation where we are able to record a portion of a phone call that we have with the client, them giving us their consent to submit an application electronically on their behalf. So we can completely fill out the application. If they're able to get their documents to us electronically, that's sometimes a little tricky, but we can basically get the application going and submit everything on their behalf. Again, it took a while of back and forth of getting the waiver and the MOU figured out between us and New York City and eventually New York State, but we did get it in place, and that's become increasingly helpful, for seniors who just need to be on the phone with us. As I mentioned earlier, there wasn't as much in-person assistance going on, so that's been huge. It's not easy, and that's something that probably a bunch of folks from around the country or around New York State have undergone that process, or maybe you're in the middle of it, but it's worth it, I would say. Another quick thing I'll just mention in terms of technology that we've used recently during COVID is the development of these benefits town halls, which we've partnered with AARP New York, and basically have reached out to tens of thousands of members that they've identified who are below a certain level of income, and they get a heads up the day before, and then we had an hour session. Hunger Solutions New York was also involved with that, where during that hour we're giving out basic information about SNAP, particularly about the ESAP program, also giving specific contact information on how to get in touch with people from all around the state, whether that's in New York City or other counties, and how to access assistance to get help applying for SNAP. And that's been pretty effective, especially working with a trusted member like AARP. So they're not just getting a call from some organization they've never heard of, but they are AARP members already. So the retention rate of people that stuck on the call and listened in and responded was, we thought, pretty great, and it was pretty worthwhile.
Awesome. Thank you so much for sharing that, Jim. I think especially I want to highlight one point in what you said, like around the town halls. I think from my knowledge, those town halls are accessible via phone. So people don't have to log into a Zoom and join the thing via an internet. So that by itself is a critical piece from our learnings, is having that inclusive ability for people to join from whatever they're comfortable with, whether it's landline or a text or any kind of phone that they have. So thank you so much for sharing that. I think on a similar note, I want to ask Paolo as well to share some of their learnings. I know AARP is doing some innovation programs with not just Blooming Health, other companies as well, to identify solutions here. So what would you share, Paolo, as some potential tools that people can use?
Jim mentioned it about the telephonic consent. That was extremely helpful. Again, if you look at it in big buckets, right, the burdensome process and what innovations work there, telephonic consent certainly makes it less burdensome in that regard. The second piece that we're seeing is actually the use of technology is increasing, and not as sometimes we have a perception of older adults, and particularly low income older adults, not using technology that much. And technology is such a broad word. There's certainly a lot of older adults using chat. right? And the ability to use chat to reach out to the older adults and to be able to help them through the process, including their reminders and so forth, is quite helpful. And then the third is not so much an innovation, more around how we focus on an older adult and meeting them where they are at. You know, it's important for the foundation to support our grantees that are working directly with communities and working in very culturally appropriate ways with, you know, particular populations that have the issues of stigma, for instance, around particular issues. And it's across the board. Many people that we talk to from African American communities, Black communities, the stigma is you are targeting us, right? You're always constantly targeting us. That's you know, in many ways inappropriate. In the API community, it's such a broad community. There's a huge difference between South Indians and Filipino Americans and Laotians and Hmongs and the lastly Pacific Islanders, which sometimes we forget about in some of the outcomes that we want to achieve and the appropriate ways to be able to connect with those. So learning to work with the communities. And I think Rose talked about people who are trusted that you want to work with. And that leads to the next point. Trusted people are also caregivers, members of the family, members of their community. We did a program in independent living facilities where other people living in those facilities were the ambassadors, and they helped folks apply for SNAP because they were all in the same, they were trusted, they saw them every single day. You know, that's the type of people we should be empowering versus purely just organizations. Now, certainly supporting organizations that do that is very important. And then the one that struck me the most was also some of the innovative approaches of where you meet the older adults. One group that we worked with were actually setting up benefits and helping people with applications while they were in laundromats, right? You had a captive audience for however long it takes to do your laundry in a laundromat. For me, it'll take me at least 2 hours. And so you're there doing the laundry and you know, there's only one TV in the laundromat and it's probably on a pretty poor channel. So there's a lot of different ways to be able to connect with folks there. They're there every week. So even some of the follow-up is going to be made easier because they're in those particular locations. So those are just some of the kind of the key learnings about just really about how we approach older adults and what the experience looks like. There's certainly a lot of things that we need to do in terms of making it worth it, right? Making the benefit worth it beyond the realm of the foundation and ARP Foundation and our approach, but certainly from a policy has a lot of implications.
Awesome. No, thank you so much for sharing that, Paulo. I think especially that point around having a culturally sensitive approach and doing it in their own communities is important because we try to tackle it from a language standpoint through the platform, but then as a counterpart of it, and an important component is the community organizations that have that culturally sensitive relationship with the older adults. And therefore, they're able to converse with them in their own language in that regards.
In some cases, Kavita, there are a lot of specific in the API communities where you can't read in your own language, right? And specifically Hmong and Laotians, the official language from a ability to read was just implemented in the 70s. So many people who migrated earlier than that had never read the language, and yet we're then trying to reach out in a specific language, and it's going to fall on deaf ears and deaf eyes, right, at this particular point because of the fact that they really do want that face-to-face and the communication with the people that they trust.
Yeah, no, I think that makes sense. So I want to briefly end the poll and display the results from the challenges quiz that we did earlier. As we said, it's no surprise to any of us here that definitely the application process comes across as the key complexity here. So on that note, I want to ask Rose and then Bob as well to talk a little bit about some of the policy changes that have happened during the pandemic that helped both with the SNAP Ed programs and others that I know, Rose, you work with, and then with Bob as well in terms of the application process that you were talking about earlier. How can we streamline applications between different benefits or anything else that's coming out of the White House conference as well? So Rose, can you please start from your end?
I actually feel like Bob is more qualified to speak on that piece. I wanted to jump off just on the community-based organizations, if I can, going back. We're hearing the same thing in that, you know, I think what I've been thinking about over the last few days is touch points. Where can you reach somebody to tell them about SNAP and help them? And I think that's where we have to open our minds and be really, really creative. We have our traditional, you know, avenues, but we have hooked up with, you know, we got some funding to do SNAP education. And so that's education, and our push is education, but there's just these pieces to that where we can teach, you know, here's a SNAP application and here's what we can do. And I guess I'm suggesting even creative, like non-threatening, in New York City, thousands of, during the pandemic, growing windowsill herbs, which seems like, but it was a powerful program. People loved it, but it was also a chance when you brought them that to give them information on SNAP. And SNAP education and SNAP benefits and how do you do that. So any venue, and also we work with Aging Live On Live On New York, who helps us in the city as well. And the same thing, as many community-based organizations as we can, you know, connect with. And also, I guess we can wait till innovations, but I just had a thought about, sometimes it's not the SNAP program, but it's us as agencies. Our contracting process is so complicated that it's hard for us sometimes to reach and contract with smaller agencies, community-based agencies that could really reach the communities that you're talking about, Pablo and everybody. So I just wanted to put that in the thought process to how we all do business. But Bob, I'm going to let you speak more to the policy pieces.
Sure. Well, and I'm happy to, and I just, in particular, from the pandemic, two things I think I want to talk about. One is, you know, getting past the application process to the actual benefits. The expansion of SNAP benefits to be used online has grown dramatically.
Yes.
Dramatically, from 5 states in March of 2020 to 49 states and the District of Columbia in August of 2022. Okay, so obviously there's a take-up of interest there. Okay, and if you combine that with increases of technology by older adults, they too are benefiting from the online aspect of it. The second thing is, again, they talked about the public health emergency before, you know, increasing the SNAP maximum benefit that helped tens of millions of people and provided emergency allotments that boosted benefits to the maximum amount for the household size. These are initiatives that the Department of Agriculture took. What the goal will be in so many areas where innovations occurred because of the pandemic, whether it's in telehealth or in some of these online with the benefits, it's the idea, just because the emergency end doesn't mean that pandemic and its consequences end. Yeah. You know, it's going to be a huge advocacy push is going to be about how many of these things can be made permanent or extended for a period of time to allow a logical transition from this period of time to that period of time. And you're going to see a lot of that, I think, in the time ahead. And I think that the other thing that is worth thinking about is, you know, there is a enhanced interest, as there should be, and the White House conference specifically called for this, for universal screening for food insecurity and malnutrition in all federal health care systems, as well as providing incentives to other payers and providers to screen for food insecurity and other social determinants of health. Okay, that allows a new range of people to be identified, and then you look for the solution to the issue that's raised through the screening. So you're beginning to see what should have been done a long time ago. My colleagues would agree with this, which is connecting nutrition and health. They're not in separate silos. They shouldn't be in separate silos. They belong together for a good reason. And I think what's being done through this White House conference, I think, can lead to that in a way that we could all be happy about.
That's great. Thank you so much, Bob, for sharing that. I think there's definitely a lot of exciting things coming in the forefront. So I want to briefly share some of our learnings from Blooming Health perspective as well through the partnership with some community organizations and in partnership with AARP as well. We were able to launch a program over the last 6 months. And the goal of this program that we launched was to enable continuous engagement with the older adults via community organizations. So community organizations are using Blooming Health platform to continuously engage older adults, everybody, regardless of their SNAP status. And in terms of informing them about SNAP, especially the amount of SNAP benefits that they could be eligible for, and also testing that knowledge, we were able to not only do we did a SNAP Education Fridays, where we were able to send broadcasts about SNAP benefits themselves, and then also do trivia after that to test their knowledge. So it's a way for reinforcing their knowledge about SNAP. And also these were ways in which we were trying to stimulate interest for them to think about, oh, maybe I should think about getting screened for this, or getting them to interested in this in a non-stigmatized or non-threatening ways that they can then start engaging with the community organizations around SNAP itself. So we did these over the course of 6 months, and then we looked at some data. We were able to also do check-ins and other things. So when we did that engagement over the course of 6 months, every time we would do a SNAP check-in, we would elicit, again, who's interested in SNAP, and then refer them to our CBO partners, caseworkers, and social workers to screen them. And this in turn led to 5 times higher casework or related units for SNAP itself. And this also helped reduce some time period between that initial application initiation and then application submission itself for SNAP by 47%. So what this showed is 2 things, right? One, in ways in which you can use technology. As Paulo said, the definition is pretty broad. You can use technology to automate some of these communications, but also personalize them in a way that it can help older adults be more aware and also engage with the relevant partners, while saving time for the community organization and the staff when they're doing this work, because we know it's very complex work that they're doing. It requires a lot of follow-ups with older adults, that requires a lot of calls to be made to older adults to check, did you receive the application? Did you fill the application? So those kind of things. So that's why we are looking to see if technology can be used in a way that can benefit older adults and the staff that are doing the work. And I think, as Jim said, there are other ways in which we can use technology as well, through virtual town hall and things like that. So as older adults technology usage increases, we should think about not just, again, telephonic-based usage of technology, but other ways like voice-activated devices and things like that that can make it easier to reach older adults in a remote setting. So that being said, I think we've talked about a lot of different solutions here. I want to ask the audience as well in terms of their approach to the solutions, and also get some of their thoughts. So I'm going to launch a quiz here. Please answer them as they pop up on your screen. So the survey itself is around 2 aspects. Number 1, how do you inform and engage older adults with SNAP-related information today? Are you using mass communication or individual notifications or in-person community events? Could be multiple, so choose multiple options. And then the second question is, how are you engaging older adults with SNAP services today versus the past 2 years when we were in a pandemic and in-person events were not as possible? Is it more in person, more virtual, or are you moving to a hybrid setting? All right, so I know we are at the last 10 minutes of our session, and so once the poll is completed, I also want to move to some Q&A that audience have submitted as well. And while the quiz is being completed, I also want to give a moment to the panelists. Are there any points that you were not able to add previously that you want to mention before we transition to the questions? All right, okay. So I think we are at around 57% participation. Anybody who wants to get their answers in, please get it in the next 5 to 10 seconds, and then I'm going to end the poll so we can see the results.
So if you didn't say 10 minutes at the beginning of that, I would have given you a couple of extra thoughts, but good thing, I'll respect your time.
No worries. Yeah, I think once we go through the questions, we should, if we have time, we should definitely cover more. So I'm going to end the poll here and see if we can display the results. Yes. So in terms of how people are engaging older adults, as I said, it's multiple choices, but it seems like individual notifications are one of the main ways in which people are connecting with them. I'm sure there are various scenarios when you use individual versus mass notifications as well, like outreach versus application follow-ups. And then in terms of how people are engaging with older adults today versus past 2 years, it definitely moved to hybrid. I think, again, this is one of the common trends we're seeing across the aging services. But in general, I'm glad that, again, the pandemic helped us adopt technology in a way that we can improve efficiencies and workflows. So with that, I want to transition to the questions that's been submitted. Nima, you want to take over?
Yes, absolutely. So a couple of questions that came in were around eligibility criteria. Gonna just combine them and ask them in one question. Some of the audience wants to know what are some of the logics basically behind the eligibility criteria. For instance, in New York City, cost of living is high, and it seems like that's not very directly influencing the decision-making criteria. A lot of people have salaries, but most of that salary goes to the basically housing, for instance, and they're cutting off on the food. Yeah, let's start from there. The other thing around criteria was one of the participants mentioned this is an interesting topic, and the research shows this as well, that a lot of people that bear like right below the criteria for SNAP are the people that cannot get any benefits, and they're at the highest pressure in cost of living. The ones that are past the threshold are getting multiple benefits. So the threshold criteria is of kind of a topic for some of the audience. I wanted to open it up to the panelists to discuss.
Yeah, I don't know if anybody specifically wants to jump in, but I'm curious to hear from Paulo and Jim. I know, Jim, you guys are working with the applications on a daily basis, so this could be top of mind for you.
I guess I could just start out quick by mentioning it, not specifically to that concern. I see the question from Millie Gonzalez about rent, but one thing that I don't think anyone has mentioned yet, that it's not necessarily something to help more seniors qualify, but once they do, to get that minimum benefit raised, right, are the out-of-pocket medical deductions. I believe, and someone correct me if I'm wrong, that this is the same across the country and not just a state-by-state rule, but I might be wrong on that. But I know for sure in New York State anyway, for seniors that have more than $35 of out-of-pocket medical expenses, they can, submit those expenses, right? And many seniors between prescriptions and other costs could have $100 or $200 a month in out-of-pocket expenses. That can substantially raise that benefit, that monthly SNAP benefit that they're receiving. I just wanted to put that out there because that's, I think, often overlooked, and it's like, oh, it's so much paperwork, but that's where, a lot of one-on-one assistance can really help. So it's not just maybe the $23 or $25 minimum benefit, it could be a lot more. Someone else might have something to say though about how the cost of rent does or doesn't get taken into account.
Yeah, the one thing go ahead, Rose, please. Yeah.
No, go ahead.
The one thing that I did notice is that, as you mentioned, Jim, there is eligibility criteria differences across states. Like there is, that's why I think AARP, when you did the research, there was more people who became eligible versus the federal criteria, especially around income levels and deductions probably that are influencing it. So I don't know if Paulo had anything, but I want Rose, if you had anything to share as well, please chime in.
No, I was just more sharing on the piece that Jim was just saying. That's exactly what we heard too. People don't often realize that they can subtract out those expenses. And also, one of the ideas that came out of messaging that we heard is, given inflation right now, to be using the messaging, not you're eligible for SNAP, but inflation is really high, and SNAP is a way to help you address inflation. You can get this benefit, use that for food, and use your other money for other resources. Mm-hmm. So some people have just talked about couching it a little bit differently because people can relate to inflation versus I need this benefit, then it doesn't seem as individual. So but yeah, the point you made, Jim, that is I was just talking with someone about that this morning. That is important to remember, and not always something that is thought of.
And just real quick, it goes without saying that everyone now is receiving, well, depending on your state, right, the maximum benefit. So, and that's a kind of a consideration for after the public health emergency is over, but just to mention the obvious.
And one thing that just I don't know that it comes right with this is that we had a response that working on increasing more vendors using EBT. So the more people we can have who accept EBT, the maybe that'll also help.
So there's a question actually in related to that, Rose, that I wanted to bring up is, do you see at any time in the near future cooked food to be a part of that as well or not? Because there are older adults that cannot cook, want to use SNAP cards to buy cooked food, but because they can't, they're draining the rest of their money eating outside and not using the SNAP benefits, basically.
Yeah, I don't know that specific to SNAP, just because our agency doesn't actually administer SNAP, but I do want to also offer that when people are right at that line, that we do have congregate meal programs that in some areas are 5 days a week. I don't know what it is in other states, but encouraging people to go to those. We've switched from the pandemic to heavily really jumping into grab and go, where someone can go grab a meal. So they don't want to sit down. They don't want to, just that interaction of grabbing the meal has become popular, as well as dining out. But I can't speak to that specific piece because we don't administer the program. Does anybody else have any knowledge on that more than I do?
I think that's a policy issue that will be addressed. There's an interesting law that was identified at the White House conference. There's a current law that inhibits SNAP retailers from stocking a variety of healthy foods as a requirement to participate in the SNAP program, which is absurd. I mean, the federal government needs to set the example, okay, not be playing behind, not playing catch up. So if you end up repealing that law, opening up the door for retailers to start serving and offering more healthy foods, that could include cooked meals under certain circumstances. So I think if that door opens, people need to jump in and start advocating and pushing.
Yeah. New York State is exploring the SNAP benefits for restaurant meals as well.
Yeah, and that we know that works well in some of the Old Americans Act programs. The restaurant partnerships have done very well.
We have time for one more question, Nima.
Yeah, so I'll bring up the topic around stigma. So how do you basically handle when older adults think that by taking SNAP, they're taking money away from other people that might need it more, basically? How do you basically convince them to use this and it is not basically taking money away from other people?
I could just, Bob.
Go ahead, Joe.
Okay, sure. And then please feel free to edit. I would just start out by stating the fact, right, that we all know that SNAP is an entitlement program. There's not a limited amount of funds available, for X amount of people. If you are eligible, you are eligible to receive the benefit. You're not taking it away from anybody else. So that's just, should not be I know it's a common perception, but it's just not the case. It's meant to expand during greater time of need. It contracts when there's less need. So I would just start out with that.
And I would take on what Rose said. Okay, bring it in the context of inflation. Okay, 11-12% increase in food prices from a year ago. Okay, and the staples that older adults rely on a lot are the places where the prices are going up the highest. And so I think if you put it in the context of, yes, we all are affected by this, there's an opportunity for some relief. Okay, these are extraordinary times. Take advantage of this opportunity. I mean, I think you might have less stigma if you put it in that context, because that's something everybody feels and sees.
Yes, and using the message that you shouldn't have to choose between food and medicine and things like that. Everybody's being hit by the pandemic is definitely something. I would just also offer, hit it head on. This wasn't with SNAP, but we were in an emergency response, and the Red Cross brought someone over to speak to aging, and the person could not go back to their apartment, but did not want to take a hotel voucher, and finally said to her, if you take this, that won't take that away from anybody else. And she said, it won't? We said, no, if you take this, and we just talked about it very openly, and she then changed her mind. So I think sometimes just bringing it right out on the table.
Great. On that note, I want to thank everybody for taking the time today. I know this time wasn't enough. There's definitely a lot more to talk about this topic. So if there's enough interest, we'll think about, again, doing a second session on this. Thank you once again, panelists, for taking the time to join us today and for sharing your thoughts. And thank you very much for the amazing discussion in the chat. I think there's a lot more insights that's going on from community exchange. So we'll make sure to share the insights from the chat and the poll results and the slides as well. Thank you once again, everybody, for joining. Have a wonderful day and day. Thank you.
Thank you.
Thanks, everybody.
You take care.
Bye.